We are the Mary Greeley Medical Center Capstone Senior Design Team from Iowa State University's Department of Industrial and Manufacturing Systems Engineering. My name is Andrew Thompson, and I worked alongside Kylie Cooper, Chelsea Davis, and Noel Preslicka. We worked with Mary Greeley in the fall of 2023's semester to fix identified shortcomings in the Emergency Medical Services Department. We strove primarily to increase the quality of patient care provided by EMS through an improved logistical structure. The objectives of the project were to reduce an overlapping response travel between Mary Greeley and Story County Medical Center as ambulances by 25%, to reduce EMS response times within the city of Ames by 10%, decrease response times outside of the city by 5%, and to decrease the distance all ambulances must travel to their calls by 10%. Our recommendations and deliverables were crafted with these goals in mind and will now be explained in detail.
But before any recommendations could be made, we had to understand the current state. Here's what we found. In the upper left corner is a heat map of all EMS calls in Ames during a one-year period. There are a couple of high-density areas on the map which informed how we relocated EMS staging locations later. The upper right corner maps is the distribution of which ambulance service is responding to calls in a given area. This was helpful in informing the actual prevalence of overlapping travel and where it may occur. What it doesn't show is the conditions that caused the overlap. The lack of information became the target of later solutions. The lower right-hand corner is part of a complete process of the entire dispatch process from the moment someone calls 911 to when an emergency room delivery is complete. Since EMS is dispatched by a number of local law enforcement entities, it was important to see the differences between them and the nuance they currently lack. The lower left-hand corner is a breakdown of call times based on Mary Greeley's time-stamped response data. This allowed us to visualize which parts of the EMS process are creating waste and therefore decreasing quality of care. Relocating staging areas will allow Mary Greeley to respond more quickly to an emergency. Currently, they only stage ambulances at the hospital. Utilizing local fire stations will allow them to serve high call density areas more quickly and help people in need much sooner. The associated savings and response times are shown in the left, and the new locations are marked on the heat map to the right.
We also recommend classifying high and low priority calls, since each call is different. Sometimes for a critical call, response times are the most important metric of success and may greatly influence patient outcomes. On the flip side, some 911 calls don't merit an ambulance response at all. We propose to adapt NACA's priority framework to help dispatchers and EMS determine the proper response. In the case of a truly non-emergent call, we propose an alternative to ambulance use. NERV, which is referred to as Mobile Integrated Health in other cities, is a more efficient vehicle that will allow Mary Greeley to maintain emergency room and ambulance availability. This will provide a more complete picture of care to the community, ensure critical resource availability, and save per call costs.
Overlapping travel increases response times and costs and was the original target for improvement. To eliminate overlapping response travel, Mary Greeley and Story County both must better understand the conditions that cause these overlaps. A new shift log was developed to track those conditions for both services. Our intent is this will be revised after a period of time, and both hospitals will work together with a better understanding. It's important to stress that this is a quality project. Mary Greeley's priority is patient care and service to the local community. We cannot place a price on a human life and therefore are excluding it from this analysis. With that being said, some cost savings can be achieved based on our deliverables, particularly the NERV. Relative to adding another ambulance, NERV will save Mary Greeley $45,000 in its first year and $70,000 in subsequent years. Combined with adding a new staging location at Fire Station 3, Mary Greeley can expect to save an average of $55,000 per year in the first 2 years. And with that concludes our presentation. Thank you for listening.